Hello everybody, my name is Callie Blue, and today I will be talking with you about schizophrenia and the homeless. Poverty and homelessness is a widely talked about topic in the United States right now for many reasons, such as economic and political reasons. But homelessness is also something that is important to learn about in this class because, as it turns out, recent studies have shown that many of those who are homeless have severe mental disorders. To start off, I would like to talk about what schizophrenia is. Schizophrenia occurs within the late teens to early 30s. There are positive symptoms of schizophrenia, which are additions to normal behavior, and these include delusions, hallucinations, etc. There are also negative symptoms, which are subtractions from normal behavior, which include poverty of speech, social withdrawal, and flat effects. In some cases, we see that one condition dominates a person, but most schizophrenics have signs of both symptoms. Type 1 schizophrenics have mostly positive symptoms, and type 2 schizophrenics have mostly negative symptoms. Schizophrenics can also experience psychomotor symptoms such as catatonia, which is muscle rigidity, to where the person will stay in the same position, tensed up for a long period of time, and simply won't move. There are 3 phases of schizophrenia, starting with the prodromal phase, which is where symptoms are not clear yet to others or even to the person themselves. But we start to see negative symptoms here where there is withdrawing socially, there's a lack of emotion, and speech patterns are very odd. And one may even mention having strange ideas. The next phase is the active phase, where symptoms are clear, and this phase is normally triggered by trauma or stress. And then the last phase is the residual phase, where a person acts as they did in the prodromal phase. Most schizophrenics have symptoms for the rest of their life, but there is a small percentage, 25%, who recover completely from the disorder. Treatments for schizophrenia include antipsychotics, which block the effects of excessive dopamine, and dopamine is tied to hallucinations and delusions. Therapies, there is psychotherapy, which includes cognitive behavioral therapy, and family and social therapy. Family therapy is helpful in helping family members understand why the patient is withdrawn and teaches them how to guide a loved one who has schizophrenia. Cognitive remediation is used as behavioral training, and it deals with cognitive abilities such as attention, memory, etc. It helps schizophrenics to recognize behavioral issues and how to fix them. Hallucination reinterpretation and acceptance works to change how the client views and reacts to their hallucinations. There are community factors which play into how schizophrenics become homeless. Of these include lack of treatment options, local services, awareness, and acceptance. And we actually see this more in areas that are impoverished. Community awareness and involvement is important in helping keep those who are mentally ill off of the streets. There are also other factors that play into this, such as patients not continuing their medications, they are experiencing traumatic or stressful experiences which trigger the effects, delusions and bizarre behavior, making living with others and alone very difficult, especially if others do not understand what the person is going through. And the more severe, the greater the risk of being homeless. Both positive and negative effects of schizophrenia would make it hard to continue productive work and family life, especially if those who work with the person or live with the person don't completely understand the disorder, which oftentimes leaves those who are severely plagued with this disorder alone. In the US, the schizophrenic population is a little more than 1%. However, within the homeless population, it's 20%. This is a big deal because it makes up such a small percentage of the US population, but such a large percentage of the homeless population. In fact, 1/3 of the homeless population has a mental disorder in general, and that is very high. Most prevalent mental disorders are schizophrenia and bipolar disorder, which are both pretty severe. It is also higher in homeless women than in men, the prevalence of it. And that's about approximately 250,000 homeless people in the US with a mental disorder. Since the 1970s, there has been a steady increase in homelessness overall, with an increase of those with a mental disorder being homeless. In state mental institutions, 27 to 36% of patients discharged become homeless within 6 months. 38% of discharged persons had no known address after 6 months. As one can assume, life for homeless schizophrenics isn't great. In fact, they are easy targets for thieves and other criminals, especially those with disability checks. They are even targeted more than those without them. Within homeless shelters, those who are mentally ill are treated as if they are in the lowest caste. They're treated as if they are untouchable. 22% of homeless women with schizophrenia were raped while being homeless, with 2/3 of them being raped multiple times, just meaning that they are an easy target for a rapist. A study found that 1/3 of all homeless women have been raped at some point. The time spent being homeless correlates with higher levels of distress, alcohol use, and low recovery rates among those with previous mental illnesses. So, how do we help homeless schizophrenics? And this more has to do with how a community can help and how our society can help, rather than the individual, because oftentimes it's hard for us to find an individual role in these things. But as a community, we can come together and really make a difference in these people's lives. So, psychologists have found 3 key ingredients to keeping the mentally ill homeless off of the streets. The first one is respect for the individual. The individual doesn't want to be treated as an untouchable, they want to be treated as a human being, which they are. They also want appealing housing options. This means housing options that actually have comfortable living space, and housing options that accommodate their mental disorder. So, for example, someone with schizophrenia, if the blinds rattle or if there's certain noises, it might kind of trigger a delusion or a hallucination of theirs. And so it might be difficult for them to live in that space. And so if nothing is done about this, they may decide just to be homeless again instead of having to deal with those triggers. And they also need secure treatment options, which is obviously important in treating the disorder. The mentally ill homeless will remain homeless unless shelters provide housing options and programs that meet the mentally ill's needs. Programs for substance abuse, since this overlaps with other mental illnesses, is also very important. One way that we have really helped out is with the homeless population, especially those with mental disorders, is with this program, and it's called the Contingency Management Program. They allow work opportunities and housing in exchange for the individual's sobriety from drugs and alcohol. Drug tests are given weekly. If one does not pass the drug test, they are moved to a shelter but are given the opportunity to retake the test in a week. 55% remained abstinent from substance abuse through this program. However, we do know that there are challenges with these programs. For these programs to work, there must be helpful support structures. Help from all support structures, formal structures include housing, income, support, and mental care. Those are the most important. But there's also informal structures, which include support from family members, not even all the time, but every once in a while, religious organizations, and communities. Communities and neighborhood communities are very important. And help from social service workers, mental health workers, and outreach workers. Therefore, everyone is a part of and can be a part of helping to keep the homeless and mentally ill off of the streets, by just being a part of a community that learns more and knows more about these illnesses. And that is all I have for y'all. Thank you.